Good afternoon, everyone. I'm just going to give it a moment for more people to join us. Good afternoon. We'll get started shortly. All right, so I'm going to get started. Good afternoon, everyone. My name is Kathleen Gouveia, and I am the SHINE Training Coordinator at the Executive Office of Elder Affairs. Joining me today are my colleagues, Kathy Grant, the Assistant SHINE Director, and Sandra Bowden, our SHINE Program Coordinator. Today, I will be presenting on cost-saving strategies for Medicare beneficiaries. This is part 2 of the 2-part series. The first presentation was on the SHINE program and a Medicare overview. If you haven't had the chance to watch it, I encourage you to watch it on the Executive Office of Elder Affairs YouTube channel. During this presentation, if you have any additional questions, please feel free to put them in the Q&A, but please remember to not share any personally identifiable information. All right, so our agenda for today. So I'm going to do a brief overview of SHINE. I'm going to talk a little bit about Medicare, Medicare costs, Medicare penalties in 2024, and federal and state programs that assist with Medicare cost. And then finally, where to go for additional help. So first, just briefly, what is the SHINE program? So the SHINE program is one of the 54 SHIP programs in the U.S. SHIP stands for State Health Insurance Program, and each state has a SHIP program, and ours here in Massachusetts is SHINE. Some of the SHIP programs can also be found under the Division of Insurance or through Elder Affairs, and ours here in Massachusetts is with the Executive Office of Elder Affairs. So we are a federally and state-funded program by the Administration for Community Living, which is a part of the U.S. Department of Health and Human Services. And our mission here at SHINE is to provide free, unbiased health insurance information, counseling, and assistance to Massachusetts Medicare beneficiaries of all ages and their caregivers. We also provide screening for public benefit programs, and I'll be talking in more detail about these today. Our program is across the state of Massachusetts. We have 13 regional offices that cover the entire state and the Greater Boston Chinese Golden Age Center, which is also statewide. Our program has over 600 certified SHINE counselors. About 60% of them are volunteers, and we have many counselors that can be found at community health centers, council on agings, hospitals. So there's many different places of where you can find a SHINE counselor. Below is the phone number for Mass Options and also our email here at the state. If you are not sure of where to locate a SHINE counselor in your region or your town, please feel free to call the 1-800 number for Mass Options. They will be able to direct you to your local office. So briefly, what is Medicare? Medicare is the federal health insurance program that helps with the cost of healthcare, but it is not comprehensive. It does not cover all medical expenses or the cost of long-term care. And what Medicare is there are 3 different parts of Medicare that help cover specific services. So Part A is your hospital insurance. Part B is your medical insurance. So think of that as receiving outpatient care services or going to your doctor, receiving physical therapy, durable medical equipment, things like that. That's going to be billed under Part B. And then your Part D is your prescription drug coverage. So thinking of that as going to your local pharmacy and picking up your prescription that your doctor has prescribed you. Then there is Part C, which really rolls everything up into one. So it's a Medicare Advantage plan, and this combines your Part A, your Part B, and usually your Part D. We look to have plans that have prescription drug coverage as well to avoid a penalty. So what are the costs for Medicare? So Part A is generally premium free. It's free for most people who have met their quarters, who have worked enough quarters and paid into the Medicare tax. If you're not sure if you have yet or not, you can go to your local Social Security office to find out, because the Social Security Administration is actually the agency that does the enrollment into Medicare. There is the Part A hospital deductible, and that is $1,632 per benefit period in 2024. So that's not an annual deductible. That could occur multiple times a year, depending on whether or not you are going into the hospital and being admitted as an inpatient. Then we have the Part B premium, that is $174.70. Generally, that is deducted directly from your Social Security check if you are taking Social Security distributions. If you are not taking Social Security yet, you will be billed on a quarterly basis for that. Then we have the Part B annual deductible. In 2024, it is $240. So that's what you are going to be responsible for every year before Medicare coverage will start to kick in. Then we have the Part D premium, and this ranges all the way from 50 cents per month all the way up to $155.80. So there are about 20 prescription drug plans that are available to Medicare beneficiaries, and so we can really do a deep dive and find a plan that's going to offer you the best coverage for yourself. Now, it's important to note that for somebody who is in higher income bracket, that the Part B and the Part D premiums can be higher if the individual's income exceeds $103,000 or $194,000 for a couple. And this is what's known as IRMA, the income related monthly adjustment amount. And it's because they look at 2 years prior tax returns. So that is the reason why some people may have a higher amount that they owe. Part D copays and plan deductibles, so those vary from plan to plan, from company to company. And then there's also supplement plans, or what's also known as a Medigap plan in Massachusetts. Our premiums range from $118 all the way up to $275. And so there's many different insurance companies that offer those Medigap plans. Now, I spoke about all of the costs to Medicare, but now there are some penalties that beneficiaries need to be aware of and try to avoid. So if you are someone who is not eligible for premium-free Part A, so you did not meet your quarters, you would you would be paying a monthly premium for your Part A. And if you did not enroll when you first became eligible for Medicare, you would actually have a Part A enrollment penalty. And that penalty is if you enroll late and you aren't eligible for premium free Part A, your monthly premium may go up 10% for twice the number of years that you signed up late. Then we have the Part B late enrollment penalty. And so if you enroll late into Part B, a surcharge is added to your monthly Part B premium, and this is a lifetime penalty. So there is no getting rid of it unless you qualify for some programs we'll talk about. The Part B late enrollment penalty is calculated as 10% of the current Part B premium for every 12-month period that you were not enrolled or did not have employer coverage through your current employment. Then we have the Part D enrollment penalty. And so if you did not have Part D coverage, even if you do not take prescription drugs, you can incur a lifetime penalty. And if you enroll late, the Part D penalty is calculated differently. It's calculated at 1% of the national base premium for each month that you did not enroll in a Part D plan or did not have creditable coverage. Creditable coverage is what is known as good as Medicare Part D. Examples of that are somebody who has VA coverage or retiree prescription drug coverage, just to name a couple. All right, so now I'm going to start to get into some of the programs. So this first one is what's known as Extra Help or Limited Income Subsidy, LIS. This is a federal assistance program to help reduce the cost of your Part D cost for beneficiaries with limited resources. And now this is for whether or not you have a Part D plan, whether you have a Part D plan or a Medicare Advantage plan with Part D coverage. But this program is really great. It subsidizes your Part C or D premiums, deductibles, and copays, and it does eliminate any late enrollment penalty that you may have with Part D. Now, how do you qualify? So there are some income and asset limits displayed here on the screen. So for an individual versus someone who is married and lives together. So again, it's at 150% of the federal poverty level, and there are some asset limits as well. Now, how does somebody apply for the Extra Help program? If they're looking to just enroll in the Extra Help program, they would do so directly with the Social Security Administration. And so there are a few different ways that you can do this. You can do this directly online, or you can do this by calling the Social Security Administration or applying with it in person at their local Social Security office. And we have a link here that does have a link to the field office locators, so you can find your local Social Security office. So now that was the federal program. Now we're going to talk about the Medicare Savings Program. So what is the Medicare Savings Program? So there are 3 different programs that help residents and people living with disabilities save money on their Medicare coverage. These programs were formerly known as the Senior Buy-In or the Mass Health Buy-In. And in an effort to stay consistent with the federal government, we will be referring to these programs by their federal names. So Qualified Medicare Beneficiary or QIMB, or Specified Low Income Beneficiary SLIMB, or Qualified Individual QI1. And so I have this divided into two sides, because on the left side is what's known as QIMB, and this program pays your Medicare A and B premiums, deductibles, and copays, and then you would also receive Extra Help. So that federal program, you would also receive that Extra Help program as well, automatically. And then on the right-hand side, these 2 programs are funded by 2 different sources. So this is why they're lumped together, because they do provide the same benefits. So they pay the Medicare Part B premium, and the beneficiary would also have automatic full Extra Help or Extra Help. So how do you know if you qualify? So there are income limits to these programs. And I will say that as of March 1st, 2024, there is no longer an asset limit. So many more people are actually eligible for these programs. So if you may have been, if you may have applied before, or somebody that you were a caretaker for may have applied and they were denied, maybe because of assets, I would strongly urge them to reapply, because this asset limit has now been eliminated. So on the left-hand side for QIMB, the income has to be at up to or equal to 190% of the federal poverty level. And then on the right-hand side, SLIMB and QI1, the income limit has to be under up to or equal to 225% of the federal poverty level. So how does one apply for the Medicare Savings Programs? So first, the application is what's known as the MHBI application. And so they can call the Mass Health Customer Service Center, or you can download an application directly from mass.gov. And then also you would mail the completed application to the address below, or you can fax it in as well. There is a new application as of March 1st. So ensure that you're using the newest application. So now I'm going to discuss Medicare and Mass Health Standard. So a beneficiary could have Medicare and also have Mass Health Standard. Now with Mass Health, it does provide a full range of medical benefits and home care services, including inpatient, outpatient, skilled nursing care, and prescription drug coverage. There are some additional benefits that are not covered under Medicare, so having Mass Health Standard really would provide you with some additional benefits, such as vision and dental. Having Mass Health Standard does provide secondary coverage for Medicare beneficiaries. It would pay deductibles, copays, and coinsurance. You would be deemed eligible for extra help, and they could pay for your Medicare Part D premium, deductible, and reduce copays for your medications because you would have that extra help program. Common Health is another program offered through Mass Health, so it does provide healthcare benefits for those with a disability whose incomes are too high to be eligible for Mass Health Standard. So with Common Health, there are no income or asset limits regardless of your age, whether you're over 65 or under 65. But if you are over the age of 65, you must meet a work requirement in order to be eligible. So the work requirement is at least 40 hours per month, and the work requirement is waived if you've been on Common Health for at least 10 years when you're turning 65. Now, if you were over the age of 65, you would use the SACA application. If you were under 65, you would be using the ACA application. So there are two different applications for Mass Health. Comprehensive Mass Health programs. Now, if you are age 19 through 64, you no longer have to meet a work requirement or a one-time deductible. Previously, you did. There is a sliding scale monthly premium for those with an income that is above 150% of the federal poverty level. So although there is no income or asset limits, if your income is over 150% of the federal poverty level, you would have a monthly premium with Common Health. You would also be deemed eligible for the extra help program as well. So that would be a great savings for somebody for their prescription costs. Frail Elder Waiver is another comprehensive program. So Frail Elder Waiver program is a home and community-based services waiver. These programs are designed to meet the needs of those who prefer to get long-term care services and supports in their home or community rather than in an institutional setting. Massachusetts does currently operate 10 home and community-based services waivers. Each are tailored to the specific population. So when we're talking about Medicare beneficiaries, this is one that we frequently see, is the Frail Elder Waiver. Once the beneficiary has been enrolled with the Frail Elder Waiver, they would have to receive a Frail Elder Waiver approved service at least monthly. So examples of that would be like Meals on Wheels or home care services in their home. And that's just a couple examples. There is a list. Once enrolled, the consumer would have Mass Health Standard coverage, and they can also enroll in a SCO plan or a senior care options, and we'll talk more about that in the next few slides. Individuals must be age 60 years or older, and if they are age 60 to 64, they must have a disability determination. Again, you must meet Mass Health clinical eligibility requirements for nursing home care. This would be screened by your aging service access point by a nurse. There are monthly income limits for the applicant, and then there are asset limits for both the applicant and if they have a spouse. The beneficiary would complete a SACA application and required sections of the long-term care supplement form. Another program offered through Mass Health is the Mass Health Personal Care Attendant or PCA program. The Mass Health program that helps people with permanent or chronic disabilities keep their independence, stay in the community, and manage their own personal care by providing funds to hire personal care attendants. The PCA consumer, the person receiving the PCA services, is the employer of the PCA and is fully responsible for recruiting, hiring, scheduling, training, and if necessary, firing PCAs. The eligibility for this program is the person has to have Medicare and Mass Health Standard or Common Health or senior care options or OneCare, but they must have a permanent or chronic disability or illness and require assistance with at least 2 activities of daily living as a result of the disability or illness. For more information on this program, and really a lot of the programs I'm talking about today, mass.gov is a great resource for additional information as well. All right, so Medicare and Health Safety Net. Health Safety Net pays for certain medically necessary services provided to qualified low-income patients at Massachusetts community health centers and acute care hospitals. There are two levels of health safety net. So there's full health safety net, and the person would have to be at or below 150% of the federal poverty level. And then partial health safety net, your income would have to be between 151% to 300% of the federal poverty level. There is no asset test for this program. Some of the coverage that it does include is that it covers the Part A deductible or hospital copays. Some services at a hospital-based affiliated or satellite clinic center. They can receive care and fill prescriptions at a community health center and hospital. But HSN drug coverage is not considered creditable, so the beneficiary, the Medicare beneficiary, would still have to have a prescription drug plan to avoid the Part D late enrollment penalty. All right, so now I'm going to get into some of the integrated care programs. So these, I'll start with OneCare, SCO, and PACE, and I'll talk a little bit more about what each one is. So the first one is OneCare. So OneCare is a way to get your Mass Health and Medicare benefits together. OneCare offers services that you can't get with your Mass Health and Medicare benefits that are separate. With OneCare, you have one plan, one card, and one person to coordinate your care. It is a better, simpler way to get care for your individual needs and goals. So again, coordinated care, no copays for services or drugs. You would receive dental and vision services and community support services as well. Now, the OneCare plans are offered in, as you can see, there are 3 different OneCare plans across the state. So you would have to ensure that you would have to go with the plan that's offered in your county. So there's Commonwealth Care Alliance, Tufts Unify, and United Healthcare Connected. The eligibility for OneCare is the person has to be between the ages of 21 and 64 years old, have both Medicare Parts A and B, have Mass Health Standard or Mass Health Common Health, do not have private insurance like insurance from a job, and you're not participating in a home and community-based waiver, for example, the Frail Elder Waiver. You would have to live in the area covered by a OneCare plan, and you may be able to remain in a OneCare plan at age 65 if you enrolled between the ages of 21 through 64. Again, for more information on this, mass.gov has a great page for OneCare. Senior Care Options, or SCO, is a comprehensive health plan that covers all of the services normally paid for through Medicare and Mass Health. This plan provides services to members through a senior care organization and its network of providers. It combines health services with social support services by coordinating care and specialized geriatric support services, along with respite care for families and caregivers. SCO offers an important advantage for eligible members over traditional fee-for-service care, and there are no copays for enrolled members. Again, the eligibility is age 65 or older, eligible for Mass Health Standard, including through the Frail Elder Waiver, and they would have to live in the SCO service area. There are 6 SCO plans here in Massachusetts, and for more information on this, you can contact the Mass Health Customer Service or one of the individual senior care organizations. On mass.gov, again, Senior Care Options, you'll be able to find more information and find the one that is in your zip code. All right, so PACE. PACE is the program of all-inclusive care for the elderly, and it is administered by Mass Health and Medicare to provide a wide range of medical, social, recreational, and wellness services to eligible participants. You do not need to be on Mass Health to enroll in PACE. However, if you do meet the income and asset guidelines, you may be eligible for Mass Health, and Mass Health may pay your PACE premium. Now, the eligibility for PACE is you'd have to be 55 years or older, live in the service area of the PACE organization, be certified by the state as eligible for nursing home care. And then if you are between the ages of 55 through 64, you must have a disability determination. You must be able to live to safely live in the community and agreed to receive health services exclusively through the PACE organization. And to find out more information and find the PACE organization that serves your area of where you live, again, you can go to mass.gov and you will be able to find additional information. All right, so some additional programs. Prescription Advantage is a state-sponsored prescription drug program for seniors and people with disabilities. It offers comprehensive prescription drug coverage for consumers who are not eligible for Medicare. It does provide financial assistance to lower prescription drug costs and fill those coverage gaps. So in the different phases of the Medicare Part D plan, the Prescription Advantage program can help with some of the gaps. PA also provides a one-time special enrollment period each year. So if you are finding that your plan is just not working for you, whether it's a Part D or a Part C plan, if you are in the Prescription Advantage program, you actually have another opportunity once a year to make a change and enroll into a different plan. So it can be incredibly helpful. So again, Prescription Advantage does fill the gaps in coverage. It is secondary prescription coverage that works with the primary prescription drug plan, such as a Medicare Part D, Medicare Advantage plan, or other creditable coverage. The eligibility is based on the gross annual income only. Assets are not looked at. And of course, if you are eligible for Mass Health or a Medicare Savings Program, you're not going to be eligible for Prescription Advantage. And really, when you are in a Medicare Savings Program or Mass Health, you're going to be receiving extra help, which is the federal prescription drug assistance program. So that's going to give you more of a comprehensive, a richer benefit than Prescription Advantage. But Prescription Advantage can be great. Especially for beneficiaries who do not qualify for one of those programs, such as Mass Health or Medicare Savings programs. So we do have the income guidelines here. If your income is over 500% of the federal poverty level, there is an enrollment fee of $200. But if it's under 500% of the federal poverty level, there is no enrollment fee. And if you're under 65 on Medicare, your income would have to be up to or equal to 188% of the federal poverty level. How does somebody apply for Prescription Advantage? So you can apply directly online. You can apply by phone. You can apply by submitting a paper application, or you can fax it as well. All right. So we work very closely with the Massachusetts College of Pharmacy and Health Science, and they have a program, the Pharmacy Outreach Program, and they are a great resource. They provide free information and referral service to help people take medications appropriately. So their mission is to promote medication adherence for the community through cost solutions and education. They are composed of pharmacists, SHINE counselors, and pharmacy students that are on staff. Their program is funded by the Executive Office of Elder Affairs, the City of Boston, the Central Mass Agency on Aging, and the Massachusetts College of Pharmacy and Health Science. I also want to mention too that this program is open to anyone in Massachusetts of any age. So if you have questions about some of your medications, you can have a consultation with them and discuss your prescriptions as well. So a little bit again of what they do. So they evaluate your insurance plans. They research ways to assist with applying to programs to help save with the cost of medication. So pretty much all of these programs that I just discussed, they will evaluate that and screen the person for some of these programs. They can answer questions about medications and diseases. They can provide medication reviews. And they also do education. They educate the community at many different community events as well. And they're open Monday through Friday, 8:30 to 5. We have provided their website and their phone number as well. All right, so the Pharmacy Outreach Program, again, these are just some of the resources that they provide information about. So special generic pricing programs. They have a prescription outreach program, co-payment foundations that they work closely with or know more about. which are charitable organizations that may help pay for certain prescription copays and plan premiums. And then the manufacturer patient assistance programs, example, Needy Meds is one of them too. So they really try to help the beneficiary find ways of, if they are looking for assistance with paying for their prescriptions, they try to screen them for programs that they may be eligible for, and then look for other resources as well. Just another strategy to reduce medication costs. So beneficiaries can look at brand versus generic, plan restrictions, alternative medications in the drug class, diagnosis, whether or not the prescription is available as an over-the-counter product, and then also the formulation. Again, just another resource, alternative prescription coverage options. So GoodRx and Single Care. These work outside of your Medicare Part D plan. So they would not be counting towards your out-of-pocket unless your Part D plan allows that. So you would have to check directly with the plan. But these sometimes offer a greater discount on some of your prescription drugs. And they have apps that you can look and search the best price at different locations such as CVS, Walgreens, Rite Aid, and Walmart. Insulin and vaccine costs. So in 2023, the Inflation Reduction Act assisted with the insulin and vaccine costs. And so we want to touch on that. So Part B and Part D or Medicare Advantage prescription drug plans must cap covered insulin at $35 a copay for a month's supply. Again, though, it's at $35 or less for a month's supply of each covered insulin. Insulin that's covered by Part D is not subject to any deductible. And then there's no more cost sharing for Part D covered vaccines. And so a big one that we see pretty often is Shingrix. So that's helping beneficiaries save more money on their insulin and vaccine costs. Just a couple of cost savings tips and reminders. So the first one is the Medicare Plan Finder. So this is a tool that our Shine counselors use to review plans with Medicare beneficiaries. And I just wanted to educate on why it's helpful to have a Medicare account. So we recommend beneficiaries establish an account on Medicare.gov when selecting coverage. And the reason why is they can import prescription history and edit or save prescription drug lists. You can compare premiums and costs in order to select the best plan for you. You have access to important billing and claims information. You can check information on current coverage and enrollment status. You can see whether or not you have extra help so again, this is the tool that Shine counselors use when counseling beneficiaries to find plans for them. Oh. Another way that a beneficiary can save money is that if they are enrolled in a Medigap plan, Medigap plans may offer an initial enrollment discount for the first couple of years. So someone may be eligible when they are new to Medicare Part B. Now, how does this work? So if somebody enrolls in Part B and they have and then they enroll in a Medigap plan, some of the discounts start at 15% off the first year base premium, and they decrease every year. So it might be 15% the first year, 10% the next year, and 5% the following year. So that can offer a little bit of a discount and save a beneficiary some money. There are some other additional discounts too that the beneficiary can review with the Medigap plans too. One of them is if there's multiple people in their home that are on Medigap plans or insured, and also premium payments made by electronic funds transfer. Again, you should contact Medigap plans directly to verify individual eligibility. And then there is the MA or Medicare Advantage Plan Part B premium reductions. So you may have heard of this, but there is what's known as like the give back benefit. So the Part B premium reduction is offered by some Medicare Advantage plans in which the MA plan may pay some of your Part B premium. Your Part B premium now is $174.70 per month. And some plans offer this premium reduction in the ranges of the amount may be $40 up to $80 this year. And it's reflected directly in the beneficiary's net Social Security payment. I will caution you, though, that finding a plan that offers this, although it may be saving you money, you want to ensure that all your medications are covered and all of your providers that you see are take that plan, because you don't want to just select this plan based off of this benefit, because your medications may not be covered and your provider may not take that plan. So it's important. And one thing that we always educate on in the past few years is the SNAP benefits. So SNAP is the Supplemental Nutrition Assistance Program, formerly known as food stamps. And we are always trying to ensure that consumers know that they can report additional expenses that they may have to increase their SNAP benefits. So medical expenses that are either one-time or recurring over $35.01 that are not reimbursed or covered by insurance can qualify somebody for receiving additional SNAP benefits. So examples of that would be any medical expenses, adult and child care costs, increases in rent or mortgage. And I know some beneficiaries may have the DTA Connect app. That's just one way of uploading proof of a document if it's anything over $190. But you would be reporting copies of receipts or bills. So it's just a great opportunity for beneficiaries who have some really high cost medical expenses that they can submit these documents to boost their SNAP benefit. So additional places of where to go for help. So the Social Security Administration, again, that is the agency that will be doing enrollment into Medicare Part A and B. So we provided the phone number and the web address and the SSA office locator. So finding your local Social Security Administration office. Medicare, 1-800-Medicare. This is, again, the agency that, that's where you receive your Medicare. That's where you would enroll in Part C and Part D and review plans. That's the agency that we work with. And then pharmacy outreach. This is the Mass College of Pharmacy and Health Sciences University, and we provided their phone number and their web address as well. Prescription Advantage, again, the State Pharmaceutical Assistance Program. We provided their website and their phone number as well. And then lastly, the SHINE program. So this is the Mass Options phone number as well, where you can really find additional resources. But if you're looking to find your local SHINE counselor and you're not sure where to go, you can call this phone number and you let them know your town, and they'll be able to provide you with the phone number for your local, where you can find your local SHINE counselor. Again, we're here to help beneficiaries with reviewing their plans, and especially during open enrollment when you're reviewing your plans and looking for the following year, whether it's Part D plan, Medicare Advantage plan, Medigap plans. We're here to assist with your Medicare options. And that's it. So thank you so much for having me.
Okay, thank you, Kathleen. That was excellent. So we are going to do a quick Q&A. We've gotten some questions in the chat and the Q&A box. So we'll ask our SHINE program team here. And if you are on the webinar live and you have additional questions that you have not yet asked, feel free to add them to the chat or the Q&A now. So the first was, apologies, my computer froze. The first was around alternative prescription coverage, the program. Do they have language capabilities? And do you know what those language capabilities are?
Which program in particular?
This wasn't noted, but maybe if you could provide maybe an overview of what languages are available in the programs and where they could find out.
Well, I can speak about the Shine program. The Shine program, we actually have bilingual counselors. We have many counselors that speak different languages. And so we're able to assist beneficiaries with other languages other than English. Same thing with mass options. Kathy, do you have anything, Kathy or Sandra, anything else to?
They may have been asking too about MCPHS and what their language capabilities are. I have to say I do not know that offhand. But I know that you covered the Mass College of Pharmacy program as part of the alternative prescriptions options slide. So but certainly I think contacting them directly, and I think someone else has asked about that web link. I see that further down in the questions. Their website may even be able to indicate what languages they offer services in.
That's right. And if we have that link, we can put that in the chat and maybe add it to the slides to send around as well. That was another one. Actually, quite a few people were hoping to get the slide deck. Kathleen, I know that we have the recording that we post on YouTube, but are you comfortable sharing these slides as well? Awesome. Okay, that's great. So we'll add that link to the slides so that folks that would like that link for the Mass College of Pharmacy have that as well. We also heard from a caregiver who wrote on, she was caring for someone with Alzheimer's, who was on Social Security, and she works part-time. And, you know, of course, without knowing the sort of the specifics of the financial situation, she's wondering what her options might be if sort of private pay would be the only option. And, you know, I think we could talk about these programs and what those options would be. I also would recommend for anyone in this situation to reach out to Mass Options, and we'll put the link in the chat to be connected with your local caregiver, family caregiver support program. Your caregiver specialist will know about all of your options for respite care, for, you know, all of these things that we're talking about. If there are subsidies, if there's another program, one of the programs that, you know, Kathleen talked about, what if, you know, the PCA program is an option, without knowing the, you know, specifics of the situation, it's hard to say, but definitely reach out to the caregiver specialist. There's also stipends that are available through the caregiver program. And, you know, there's extra funding right now for those stipends for caregivers. So it's always a great time to be connected with your caregiver specialist, but especially for the next year. So definitely reach out there. But I don't know, Kathleen, Kathy, Sandra, if you had other.
I think everything you just said was great. And I think just in addition, just meeting with a Shine counselor, because we can sit down and kind of look at your coverage, what you're looking for. And if we don't know the answer to, you know, particularly one of the Mass Health programs, we'll be able to refer you to the appropriate place.
That's great. Someone just wrote into the chat, how do they get more information on PACE?
So I would say the first place may be to start with, first, if you're not sure of where your aging service access point is, to reach out to Mass Options. They'll be able to tell you where your ASAP is, but your ASAP will be able to provide you with information on the PCA program in, I'm sorry, was it PCA or PACE?
PACE.
PACE, I'm sorry.
Yes,
I'm
PACE.
sorry. PCA, that's how the PCA.
You know what, though?
PACE.
I bet there's someone that's saying, oh, I
Yeah.
was actually talking about
Okay.
PCA and I was looking for more information about PCA. We have a lot of acronyms in this space.
Yeah.
So also for folks who are listening and they're going, PCA, PACE, I thought they were the same
I
thing.
know.
Don't worry. Just call Mass Options and they'll tell you what these mean, or, you know,
Yeah.
write into Mass Caregiver at mass.gov.
Yeah.
Kathy, go ahead. It looks like.
Yeah, so I would say Mass Options is a great place to start, even for understanding more about the PACE program, because as Kathleen mentioned, it's not offered everywhere, although we expect that that's going to be expanding in the coming year. But also on mass.gov, maybe a place to start is to, first of all, check and see whether it's offered in the area of the person that you're interested in enrolling in it. And then contact one of those programs directly if you want to learn a little bit more about exactly what it entails, because they're the best ones, I think, to speak to, you know, what the program is like. It's a little different than some of the other programs because it's offered at a central location. But those are the best folks, I think, to speak with, even if it isn't something that's in your area right now. If you want to learn more about it, that's where I would recommend going. So start at mass.gov, look up the PACE programs that are listed there. Mass.gov's great, has a search function. And again, you can call Mass Options and ask them to do the same for you. But that's where I would start to learn more about PACE.
It's great. And I just put in the chat the website for Mass Options and the phone number. And if you're joining live, phone number is 800, or not live, if you're joining the recording, it's 800-243-4636. And if you just Google Mass Options, you can chat with a Mass Options counselor, call them, you can email. There's many languages that you know, Mass Options is available in. So that's a really good one. First step in all of this.
I also wanted to point out that based on a previous question, a couple of us have put in the link to the MCPHS Pharmacy Outreach Program. MCPHS has its own website because it is a college. But that particular link that we've put in the chat is specific to the pharmacy outreach program, some of the benefits that Kathleen was talking about earlier. So that's the link that I would use for them.
That's great. Okay. Any last notes for folks on the webinar?
I would just say that we went through a lot of information in a short amount of time. So this was really like an overview of the programs. And if you're interested in learning more, please don't hesitate to reach out to, again, Mass Options. If you're looking for a Shine counselor to look at, you know, your Medicare costs and options, again, reach out to the Shine program. If you're not sure of where to find your Shine counselor, calling Mass Options, they'll be able to point you in the right direction of a Shine counselor in your area.
That's great. And I think, you know, there were a few people that wrote in about their specific situations, and I think that would be our recommendation. It's hard to, you know, answer each particular person's, you know, caregiving situation and how to proceed, but you know, that's the Shine counselors, that's their specialty, and they're going to be able to help you. So that's really a good next step. And I'm sorry that we can't work with each of you today, but I've put our webinar series email address in the chat. If you have questions, concerns, recommendations, it's massoptions@mass.gov. And I'm going to put a link in the chat for our next webinar on Friday, April 26th. But I just want to say thank you to the Shine team, and especially Kathleen, for joining us twice and providing this excellent information. It's been really incredibly helpful, and we've been getting really wonderful feedback on everything that you've shared. So thank you for joining.
For having me.
Thanks everyone for taking the time too. Everyone that joined the webinar today, really happy to have you. Thanks for taking the time for yourself, and hope to see you next month. So have a great day.